MedPal AI is a digital health and artificial intelligence company focused on wellness management and the operation of a UK distance selling pharmacy known as a DSP. It listed on AIM in August, and since then the company has expanded via acquisition. And Optimo Research has released a note on the company. A lot to talk about. So we are delighted to be joined by MedPal's founder and chief executive, Jason Drummond. So Jason, welcome. Now at present, two strands to the business, the digital health app. So who needs it and who is currently using it?
So our first product, as you mentioned, is the MedPal Health and Wellness app. It's an app where you can integrate, where it integrates pretty much every single different connected health device you can think of, everything from Oura Rings, Fitbits, Garmin, Apple watches, Apple. We also work across both the Android and the Apple ecosystems. So, and it also integrates all the data from a lot of the really kind of big apps that you might like Strava and so on. So the idea is that MedPal collects all of your information in one place. You may not be aware, but over half of the UK population, adult population, has at least one, if not two, connected health devices. So the problem we're solving there is, information overload. If you've got multiple devices, we give you one app that can track everything. So that's basically the MedPal app, and it gives you one location for all of that data. You can also upload your for example, blood test results, any information you have from your GP, any test results, all go into MedPal. Then we have very advanced AI, which can make sense of the information, can give you health and wellness advice. And as you mentioned, with the acquisition of the universal pharmacy, the DSP, which gives us the ability to then give you access to GPs. Independent prescribers who can prescribe medication, and we have a new 10,000 square foot distribution centre which can now ship that medication anywhere in the UK, either same day. We have same day in some locations and next day in everywhere else.
Okay, so let's unpick some of that, because I'm just wondering, therefore, is your USP the fact that the app can aggregate multiple apps out there and you're essentially a one-stop shop?
Exactly, that's really the intention. Is really giving this sort of an integrated sort of AI-powered healthcare ecosystem that operates 24/7, and ultimately making primary care instantly available at ultra low cost. And that's really through the use of the AI and also advanced robotics that we've built into the distribution center. So it's driving the price down. So our aim really is making healthcare instantly accessible and affordable for everyone, which is really what we've done. I think the way to look at the health and wellness app, we have a very interesting, distribution deal with ePharmacy, which is Europe's largest employee benefit company. They have 22 million employees in Europe on their employee benefits programs. They have over 2,000 large corporate clients in the UK. That gives us access in the UK to over 11 million ePharmacy employees, users who have gym membership. So it's 11 million ePharmacy members who go to the gym in the UK. We also just recently did a deal with Independent Gym Network, which have over 2,000 independent gyms in the UK. So we have access to over 13 million gym members out of a potential 15 million, which is pretty exciting. So you can look at it as really a complementary flywheel across demand generation. So we have that huge volume of people who are interested in their health, want to get good health results, and we now have this ability to do fulfillment and access to primary care.
So you have these transactions with ePharmacy and the Independent Gyms Network. Are there more B2B tie-ups in the pipeline, and how is conversion progressing from the direct to consumer audience?
Yeah, we launched the pharmacy service 2 weeks ago. We're now actively trading. We'll have some numbers out, I guess, in due course to give you an indication of that. But the take-up's been very positive. We're still really just getting going with the gyms, because we're tackling each gym one by one. So, for example, ePharmacy has 1.2 million members with David Lloyd Club. So we're trying to get the best possible conversion of those members to get the app on the phone. The app, it's around £30 a year for the app. We give it to the ePharmacy gym members for free for 12 months. So there's a really decent deal there. So we're just trying to make sure we can get it onto as many people's phones as possible. And the feeling is, if you look at the kind of the core product offering, not only we're tracking all of your data in real time, we can also use advanced AI to make sense of your for example, blood test results, any test results you might have. And the way it can work is that AI is incredibly intelligent. It's like the most intelligent kind of GP you've ever known. It can see problems, and what's interesting, when it sees a particular problem where it thinks that medication or where medication could be useful, it can actually escalate those cases to qualified independent prescribers and GPs, and then once they basically press the button on the prescription, the medications are dispensed automatically. So it's really, why would you not want to have MedPal on your phone to give you instant access pretty much for free to GPs and independent prescribers?
Okay, so it's pretty much for free, but how does the company make money?
Well, what's interesting is that by using the AI and by using the robotics, it's completely changed the economics of the business. If you look, for example, at a typical GP in a GP practice, or even if you think about what we're trying to achieve, which is instant access of basically affordable healthcare for everyone. The idea that you can just pick up your phone and within literally a few minutes you can go through AI triage, which makes sense of your issues and problems, has access to all your information or your test results, and it then basically makes a recommendation, which it hands you over to an independent prescriber or GP that can then approve the recommendation. So it's just enabling, for example, a GP. A lot of the work is done by the AI, so it means a GP, rather than seeing, say, 20 or 25 patients in a day, in theory they can see maybe 300 or 400 patients in a day, which is a huge improvement. And the same in terms of the robotic dispensing. We mentioned this new facility that we have, a 10,000 square foot facility, where we've implemented the latest robotic dispensing technology. Not only does that massively improve error rate, so typically you get a 2% error rate in traditional pharmacies. The robots are like 99.99% accurate, so you don't get those kind of issues. But also you see at least a 10x improvement in speed in distribution via the robots. So in other words, all of these things really enable us to offer the service at basically free. You just pay for the medication. We'll do everything else. That's all. That's for free. So it's a unique product in the market.
So we talk about data. We have to talk about safety, though, because as you outsource development services for the app to mobile app software development specialist Newsoft, how can you ensure firewalls and data protection and prevent hacks?
Well, as you can imagine, that is at the heart of what we do, protecting people's data. We don't make that data very available to anyone. Also, my background, I was the founder of FairFX, which was an online bank, got sold, in fact, took it public on the AIM market a few years ago. It got sold for 300 million at Christmas. So you imagine we were dealing with billions of dollars of payments and payment transactions. So I have a huge background in very successfully managing money and payments online, and ultimately managing people's data. So we're very happy that we meet meet and exceed all of the requirements. And don't forget, we're also now regulated as a pharmacy, which also has a huge regulation that comes with that.
So Jason, talk to me about the acquisition of Universal's distance selling pharmacy. First of all, what is a distance selling pharmacy, and how are you going to integrate your technology into this recently bought business?
So the distance selling pharmacy license, or they call it the DSP license, enables nationwide medication distribution. So we can basically ship medication across the United Kingdom. It's a very valuable thing to have, because the GPHC, which governs the pharmacy industry, stopped issuing new DSP licenses in June 2025. So it's a really sort of scarce regulatory asset that gives us a bit of a competitive moat. You can't get one of those licenses now. So that's at the heart of what we do. That gives us, we bought a distribution center, that came with that asset of Universal. We've just trebled it in size, and we've implemented and installed the latest robotic dispensing systems to give us a sort of 24/7 operation, and we're targeting over 100,000 orders of prescriptions a month through that facility. How it all sort of gels together, and people ask me, well, how do you go from health and wellness to owning this DSP license? Well, I guess the way to look at it is, you imagine you wake up in the morning, or you're not feeling great, point, you go to your MedPal app. The app has access to all of your medical information, your blood test results. It has all your live data. It has your heart rate, all your other information. You start asking it questions about, you're not feeling great. It will then the AI, which has been trained in all of the knowledge that exists in the world, it is it's like a sort of the best GP that you've ever come across. It will assess and intelligently assesses your the information. It does like an AI triage over your symptoms, and at some point it can say, okay, do you know that I can see an issue here, I can see a problem. We're now going to go down a particular route on a particular medication. They ask you a series of questions, which are basically prescribed by the governing organisations for GPs and for prescribers. It takes you through that journey. At the end, it says, okay, it looks like you probably need this medication. It then hands you over instantly to a GP or to an independent prescriber. It's multimodal, so we connect you over text, over whatever mechanism you like to communicate. The GP can then ask you further questions over text, over WhatsApp, maybe on a video call. They then press a button saying, great, we're happy with that. It issues the prescription on our platform. The platform is integrated to the DSP facility. The robots literally pick the medication in 90 seconds. It goes into a prescription bag and gets shipped out to you same day, next day. So it's a complete 365-degree solution, right through tracking your heart rate on your Apple Watch or your Oura Ring, through to assessing your needs, and then escalating it, complex cases to an independent prescriber or GP. And then ultimately, once prescribed, the medication is dispensed by our sort of state-of-the-art robotic technology from our national distribution center. So it is a sort of complementary flywheel. We have the demand, we have the health and wellness, and then we have ultimately the fulfillment. So it's a completely integrated solution. Nothing like this exists in the UK at the moment, so we're very excited about it.
Okay, now another question about challenges. Whilst you can automate this system for the distance selling pharmacy, is the biggest challenge actually getting the medicine to the consumer, like trusted couriers, for example? And I'm not going to mention any brands who frequently let me down with my parcels.
Yeah, so we've taken the decision. We're working very closely with APC, one of the UK's leading courier companies, and we offer a next day. We have a same day service actually in some locations. We actually run our own small fleet of vehicles, but in terms of next day delivery, we work with a very well regarded specialist that offers tracking, so you see literally in real time which route they're on. You'll drop 10 of 15. Now that's a little bit more expensive than just using Royal Mail, but we think that's well worth the benefit to the customers.
Let's talk about other benefits to the customers, because the company has a strategic focus on weight loss drugs. These obesity treatments are making headlines and attracting the attention of both the government and regulators. Could this present problems for your focus on lifestyle treatments, or don't you view it as a lifestyle treatment and an essential one?
I think we do view it as a lifestyle treatment. There are 2.5 million people in the UK spending 500 million a month on weight loss medication. It's a huge market. I'm sure we all have friends, family members that benefited significantly with significant weight reduction. The benefits are pretty exciting. There's some very good independent research out there. I think we approach it in a very, very good way, dare I say, in a very healthy way. Bearing in mind, we already start with an app that aggregates all of your health data. So we actually have access, for example, to your BMI, your weight, your height. We know when you're training. We know literally your training regimes and so on. So we're one of the good guys in weight loss. We're going to be tracking you. We also are about to launch a range, or we're going to be launching a range of advanced supplements in the future, which will help support your weight loss journey. And of course, we have this deal with pretty much more gyms in the UK certainly than anyone else, pretty much most gyms in the UK. So in theory, we can give you a complete solution, which not only the medication, we can track your progress. So we're doing it in a really, I would say, a very ethical way. I think there is some criticism of some companies online who are basically making it way too easy to get the weight loss medication. We're certainly doing it in following the guidelines and doing it in a very ethical way.
In terms of launches, you're currently UK based. Are there any plans for an international rollout?
Exactly. That's absolutely correct. We have the app. The app is interesting because the health and wellness element of the app means that it's unregulated. It's not deemed to be a medical device. So we already have that sitting on the app stores in Germany, in France, in Italy. So that's probably, we already have customers in those regions. In terms of the service we offer in the UK, then we're looking to build and scale the service in the UK. And with the lessons that we learn regarding the implementation of the AI triage, the implementation of the GPs and the independent prescribers, and ultimately also the fulfillment, because you can imagine fulfilling tens of thousands of items a month is not trivial. We said that the new facility in the Echo Business Park that we've just expanded and added in the Omnicell and the VBM BD-Row robotic systems, they can already process over 100,000 prescriptions per month. So, that's not a trivial thing to do. So we're now looking at other markets in Europe which have the same characteristics as the UK in terms of where they have the equivalent of a distance selling pharmacy license, where we can supply pharmacy and medication across the market in a country, and also where the GPs and independent prescribers can communicate with the users, with the patients effectively over text, over the internet, and over video, rather than having to do it in person.
So just recently, there's been a research note from Optimo Research, a very thorough analysis. I read it before this interview. Does it give investors, however, a good insight into the soul and the potential of the business?
Yeah, I was really impressed. The analysts seemed to really understand the business, which was great. I think what was also quite interesting for me, obviously I've founder and CEO, so this strategy is my strategy. This idea of making healthcare instantly accessible and affordable for everyone. I think it's a big mission, but we're excited about it, and I think that they really understood that. They also understood the model. The model is quite straightforward. When you have, for example, you have private prescriptions, you have NHS prescriptions. The minimum you make revenue-wise around £10 for an NHS prescription. Private prescriptions on, for example, weight loss could be £200 to £300 a month. So it gives you a good understanding of how that works and how those revenues flow through, which is great. And it also understands the revenue metrics around the take up of the gym users through your Parsi and independent gym network. And I think they did a really good job in explaining how, you might look at it and say, well, hang on, you have a health and wellness app, you have this pharmacy business. How does that come together? And I understand this idea of this complementary flywheel that keeps spinning, which, with demand generation across the app, and then the fulfillment and the GP services, and just doing this in a way where, by using the AI, the AI triage system intelligently assesses a patient's needs in seconds and fast tracking routine medication requests and escalating cases to GPs and prescribers. It's super efficient. And then having the fulfillment capability that we have, it gives us this sort of complete 365-degree approach to healthcare, which, we think is pretty unique. We haven't come across anyone else in the UK doing what we're doing. And the plan now is just got to get the message out there to those 11 million gym members and start driving significant revenues through the business.
And finally, what's next? More acquisitions, developing and refining the tech, marketing the online pharmacy business, all of the above?
Yeah, all of the above. If you followed me on my previous public companies, we tend to have a strategy which is both organic growth and acquisitions. So certainly you'll see transactions, acquisitions coming along the way. We have the ability, or I've certainly closed very significant deals with big distribution deals in the past. We have pretty much the biggest distribution deal that exists in Europe at the moment, with the biggest provider of employee benefits services to 22 million people. So we'll be doing deals of that kind of size and scale. Obviously, we're very ambitious. As I mentioned, my last company got acquired for 300 million in cash at Christmas. So clearly we want to make this more successful than that.
So a busy time ahead. Jason Drummond, Chief Executive and founder of MedPal AI. Thank you very much indeed.
Thank you very much for your time.